Moment. Okay.
Okay, so today we're going to test the neck, alright? Just remember from my previous blog, if someone's got neck restrictions, neck pain, test the T-spine, thoracic spine. So if they're stuck in a bit of flexion, they're going to have problems getting full neck movement. Okay, so clear the T-spine first, then move on to the neck. Okay, so use whatever movements you want to. This is what I've learned from Craig Cook and Charlie Weingroff, two great physical therapists. Okay, I will show her what I want and then she will do. Don't talk too much to people. Okay, so Minty, I want you to keep your mouth closed. Put your chin as close to your chest as possible. Don't move that. Okay, so if I can, and relax, if I can get my finger between the chin and the collarbones, that's pretty good. She gets her chin all the way down, so good neck movement. Next one, keeping your mouth closed, look back as far as you can. And what we're looking for here is the face 10 degrees parallel to the floor. That's horizontal. Fantastic. So good flexion, good extension. Okay, next movement. Again, your mouth closed. You're going to rotate. Put your chin down onto your clavicle. Very good. Other side. Okay. And all you're looking for here is compensations or ease of movement. Alright? So I don't know if you saw, she lifted the shoulder slightly when she moved to the right. So let's just retest that. Go to the left, down and to the right. Okay. And you'll see there's a lift on the left. So I don't know what muscles are involved, okay, but this pattern is not the same as when she rotates to the left. So I would like to improve this. So what I'll do, Min, can you turn around and face me? Okay. All I want you to do when I'm behind, you to rotate to the right and rotate to the left. We'll test this movement. So look to your right and look to your left. To the right and to the left. Right. Quite a small difference, but to the left is easier and the movement is a little bit bigger than to the right. So all I'm going to do now is see if I can improve this movement with PNF. Okay, so PNF, it's proprioceptive neuromuscular facilitation. It's a fancy way of saying I do something to stimulate you to do something. Alright, so I'm going to click my fingers. Mint, I want you to look at my fingers. Look hard with your eyes. Can you see? Can you see? Can you see? And relax. Okay, one more time. Click my fingers. Can you see? And relax. Right. So all I'm doing here, I'm using Mint's eyes to drive the movement. And if you put your fingers, on the back of your skull, and you do this with your eyes, you will feel the muscles moving underneath your fingers. So your eyes drive movement. So I'm seeing whether getting Mint to use her eyes can increase her neck movement. In which case, she probably doesn't have any soft tissue restrictions. It's just a movement that she doesn't do enough of. So if this works and I improve the movement, I tell her to go home and use her eyes and practice this rotation to the right that's limited. If not, if it doesn't improve, I have to put her down and do soft tissue work. She probably has got restrictions, okay, in the fascia, in the muscles, and the joints. Okay, so I'll do that again. Mint, follow my finger. Follow my finger, follow my finger, and relax. Try not to move your body. Follow my finger, and relax. Right. I can also, this is based on the way babies develop, get her to use her tongue. Yeah? So she can look and she can push her tongue into the side of her mouth. This is how babies move. The tongue and the eyes drive movement. So it looks a bit funny. Probably want to do this in private. We'll get Mint to use the tongue now. So, Mint, if you can look to your right, follow my fingers and put your tongue in your cheek. Push hard, push hard, push hard. Fantastic. Okay, now we'll retest. Look to your left, please. And look to your right. And this was the dysfunctional side. Okay. I think that improved. Alright? So PNF actually improved the movement. Fine. If it didn't, I would have to go down and do soft tissue work, which I'll show you in the next clip. Okay, thank you, Matthew.